Introducing a new method of sterile catheterization from the Bard Medical Division of CR Bard Incorporated. The Bard Touchless Plus Intermittent Catheter System. A totally closed system that helps to minimize the risk of urinary tract infection because the catheter is never touched during the procedure. In addition, it offers the user an easy and efficient method of intermittent self-catheterization. In fact, the Bard Touchless Plus system is so simple and easy to learn that valuable time can be saved after only a few uses. Based on your preference and needs, kits are available in a choice of 8, 10, 12, or 14 French catheters, in red rubber or vinyl. The red rubber catheter is also available in a 14 French coude tip, which is used to facilitate placement for male patients with tortuous urethras or enlarged prostates. Each catheter is pre-lubricated for easy insertion, reducing discomfort. And every catheter comes sealed in an 1100 cc flexible collection bag. This collection bag is also durable, virtually eliminating the risk of leaks. Note the catheter cap with a pull ring for easy removal, especially for people with limited dexterity. The flexible introducer tip positions the catheter in the urethra, bypassing the meatus to reduce the risk of infection. The catheter guide allows the user to control the insertion of the catheter with the touch of a finger. Each kit includes a waterproof underpad, 3 povidone iodine swabs, and 2 ambidextrous vinyl gloves. Kits without these components are also available for those who wish to perform a clean self-catheterization technique. Either way, with the Bard Touchless Plus system, the catheter is never exposed or in contact with the urethral opening, helping to reduce the risk of urinary tract infection. Now let's demonstrate the proper technique for a male performing an intermittent self-catheterization procedure. To prepare for the procedure, open the kit and remove the contents. It's recommended that gloves be worn to maintain a sterile technique during the procedure. Prep the urethral meatus and the glans penis by using a circular expanding pattern with the 3 povidone swabs provided. While squeezing the tabs on the side, remove the cap from the introducer tip. While holding the penis, guide the introducer tip into the urethra no further than the flange base. With your dominant hand, grasp the catheter through the bag approximately 1 inch below the catheter guide and advance the catheter into the urethra. The catheter should be inserted by short, repetitive pushing motions. If you encounter a slight resistance while moving the catheter through the urethra, you can adjust the position of the urethra with a slight up and down movement of the penis. Remember, Bard also carries a coude tip catheter for those who need it. Continue to advance the catheter until it reaches the bladder and the urine starts to flow. Allow the urine to flow freely, making certain the top of the collection bag is elevated at least 4 inches above the lower portion of the bag. Let the urine flow until the bladder is empty or the bag is filled. After urine ceases to flow or an appropriate volume has been collected, you may withdraw the catheter. Hold the bag upright to note the volume collected. Remove the catheter from the collection bag by pulling it out through the introducer tip and discard in a normal manner. The filled bag may be closed by replacing the cap on the introducer tip. Make sure it snaps on securely. When ready, you can later remove the introducer tip to empty the bag. Now let's demonstrate how a female can perform this self-catheterization procedure with the Touchless Plus system. Open the kit and take out the contents. While holding the outer labia apart with a gloved hand, locate the urethral meatus. Prep the urethral meatus and surrounding area by using a right to left to center pattern with the 3 povidone iodine swabs provided. Then, while squeezing the tabs, remove the cap from the introducer tip and save the cap for later. Now, while holding the inner labia apart, guide the introducer tip into the urethra. Insert the tip no further than the flange base. Put your dominant hand on the fingertip control guide to stabilize the catheter. With your other hand, grasp the catheter through the bag approximately 1 inch below the fingertip control guide and push the catheter into the urethra. The catheter is pre-lubricated, so it should slide in easily. Use short, repetitive pushing motions to move the catheter until you reach the bladder. Only 1.5 to 2 inches of catheter are required to reach the bladder. Let the urine flow freely, making certain that the catheter guide is elevated at least 4 inches above the lower portion of the bag. When the bladder is empty or the bag is filled, withdraw the bag and the catheter simultaneously. Hold the bag upright to note the volume collected. Remove the catheter from the collection bag by pulling it out through the introducer tip and discard in a normal manner. The filled bag may be closed by replacing the cap on the introducer tip. Make sure it snaps on securely. When ready, you can later remove the introducer tip to empty the bag. You'll find easy-to-follow instructions for use inside the Touchless Plus catheter kit. The Bard Touchless Plus catheter system, a faster, better way to perform intermittent catheterization, helping reduce the potential for a urinary tract infection. Available from the Bard Medical Division of C.R. Bard Incorporated, the most experienced name in urology.